Right now, welcome back. We're now going to have a look at burns. Uh, um, the Really the area about burns, it's all about what the depth is and the surface area of the skin that's been damaged. Yeah, so it's all about area and depth to determine the seriousness of the burn. So when we're talking about superficial burns, we're talking about a burn which is obviously on the surface. That could be through a scald or through steam, extraordinarily painful because the pain receptors in your body are quite close to the surface of the skin. So it's quite obvious what it is. It'll be red, tender, swollen, and extremely painful. If you've ever had a burn, you'll know it's just absolutely agony. We could mention, if you like, sunburn as well, which is obviously a major concern for a small child. We need to make sure we protect them from the sun's intensity, and especially in the summer months. Partial thickness burn is when it's actually penetrated deeper into the skin, it's gone through and into the tissue, and that can create a blister. Basically, the fluid moves into that area, your own body, to try and protect it from damage, trying to cool it. It will feel extremely painful, blistered. If it's over 1%, and we'll talk about how to do that, if it's over 1%, really you need to go to the doctor to get it checked out, because it can cause infection. So the way to measure that is you would measure that roughly by the size of the hand of the person you're treating. So don't use your own hand if you're dealing with, say, a 2-year-old. It's their hand that determines what a 1% is. Anything over 1% is a problem, and it needs to get looked at, especially for infection and shock. So just bear that in mind as a good gauge. Don't make the mistake of using your hand on a smaller person. It's obviously not going to work. At 9% over that, you don't even muck around. You're activating the emergency services or something as severe as 9%. Yeah, something like that, we call it the rule of nines. That would be something like an arm, or a leg, or the head, or the front of the chest, or the back. So any of these areas roughly works out at around about, they're at 9%. So we'll call it the sort of rule of nines. This is a full thickness burn. Yeah, now there's going to be some images that you're going to see in a minute which look quite graphic, so I'm warning you now. It's a real burn, just to prepare you. So it's gone through the skin, a full thickness burn. It's actually possibly entered the fat and the muscle as well. Strangely, it doesn't tend to be as painful, so I've been told, because the nerves on the surface have already been damaged. So it's gone through that. So although it's more serious, it's less painful. So we're going to deal with the situation as quickly as possible. If you think about it, what's happened is energy, be it fire or steam or water or a chemical of that, has been placed on the body and it's reacted. And we need to take the energy out of that damage that it's causing as quickly as possible. So the treatment is to cool. Yeah, is to try and cool the area as quickly as possible. And water is, without a doubt, the best treatment. To get access to that quickly will reduce the chance of further damage and scarring. It's all about really quick, early intervention. If there's nothing available that's water, in an emergency, anything will quickly do while somebody gets hold of something like water. So anything, just something that's an inert liquid. I've heard of people saying they're at a barbecue and somebody just poured a can of beer over the injury. In an immediate treatment, I would say, yeah, I would do that. But really you want water, but you don't want to delay that treatment. Many years ago, when I used to work on the beach as a lifeguard, there was always that lack of water around. And people say, "Oh, you can't put their feet in the sea because, the water's dirty." But if somebody walks on a hot a hot piece of beach which has had a barbecue, and you can't get water to them within, say, 2 or 3 minutes, anything to cool that burn is beneficial. You've got to cool it down with whatever you've got around. Infection can be dealt with later on, but the damage is being done while they're still hot. Remove anything around the area. Obviously, we want to stop the restriction of blood flow, and we're trying to avoid the swelling that will come if you've got a ring on the hand, if you've got a bracelet, anything like that. That's got to get removed because the body will start to put fluid in that area and it will start to swell. And you would dress it. Now, really what we're looking for is anything that's fluff free and clean. An ideal treatment, temporary treatment, is cling film, because it can seal the wound once you've cooled it, because it can seal the wound from the air and it can keep it clean, because our main concern after cooling and removing any restrictive garments is to make sure it's sealed from the air. Just finally on the removal, it's very important that we're careful during burns not to start removing lots of clothing. If the clothing has been damaged, we need to be really careful. If we take clothing off at that point, say a nylon sweater or something like that, you could actually cause more damage. So when I'm talking about removing, I'm talking about items which can constrict the movement, like watches and stuff like that. So we're going to actually douse, which means to keep the water flowing. It's much better to be under a running tap than to be sort of sitting in a basin of water, because that constant cooling is much better at taking the heat away. If it's chemically based, if it's any kind of chemical that's corrosive, be it acid or alkali, we would keep doing it longer for up to 20 minutes, because what that's doing is it's actually washing the chemical away. As discussed, remove the jewellery, and cover with a clean, sterile, fluff-free dressing, but ideal, cling film is a good option. Things to avoid: try to avoid contact with the area for infection. It's always very tempting to burst the blisters, but again, we don't want to get around that sort of treatment. That's no for us to decide. That's for a medical professional to decide on whether that's the appropriate thing to do. And we don't apply any kind of artificial fats or creams or anything like that. It used to be like an old treatment. We don't do that. And we don't, as I say, remove any clothing that's actually stuck to the skin, because you're going to take the skin with you. Right, spinal injuries. I've got a little bit of research work for you. Hopefully, as I said through the course, you've been going on to Wikipedia and Google and things like that. And what I'd like you to do is, I'd like you to do some research now on the modified recovery position. As you can imagine, spinal injuries are very serious, and the big concern we constantly get with people that are injured is don't move them because they may have injured themselves, and that's absolutely correct. In almost all circumstances, the less movement you carry out, the less chance you've got of aggravating the injury. However, there are times when that cannot happen. If a person's on their back and they've got low levels of consciousness, they can have an affected airway because of their tongue. We don't swallow the tongue, but it can slump at the back of the throat with low levels of responsiveness, or they could vomit. So we need to think about what we can do to still protect that person's airway if they've got low levels of consciousness or they're vomiting, and still protect the spine. And that's something to think about. So if you have come across a situation, road traffic accident, motorcyclist that's fallen off, bike, child that's fallen down some stairs, you need to think about a spinal injury, but you've got to have options if that person's got lower levels of responsiveness. Your instructor will be able to show you some stuff to practice, but do a little bit of research now, and hopefully you've got some ideas if you just do some Googles, okay?